Hi there, Kegels here at Reclaiming Feminine Fire channel. Thanks for joining me. Today I'm talking about reclaiming your fire, reclaiming your health and wellness through Kegel exercises. Many people have heard of Kegels, but don't quite know what it is. And I just want to give you a bit of some anatomy education and how we use Kegel exercises in Reclaiming Feminine Fire practices. So here at Reclaiming Feminine Fire, we use a lot of Kegel practices to help build our internal fire. The Kegels themselves, those exercises, help to the exercise help to fuel energy into the pelvic area, and it also helps to stimulate some heat in that area, causing a lot of energy and blood flow to go to that area. So that's part of the explanation. But I don't want to get lost in actually showing you what the Kegels are. So let me start with showing you a diagram here. So here you'll see different parts of the anatomy that can help us understand what Kegels are. So I've got my mouse here. Hopefully you can see it. In the female body, you'll see that the red part here is actually the pelvic floor. So when we talk about the Kegels, we talk about the pelvic floor. It was a Dr. Kegel who started talking about how the pelvic floor muscles were important. So that's why we call them Kegels. But it's the pelvic floor here that you see that is supporting not only the sexual organs, but also the uterus, the rectum. It's even connected to the spinal column, you can see here. So the pelvic floor supports all these organs, and it is the floor that is underneath the pelvic bones, like that strands from one side of the pelvic bone to the other, from one hip to the other. And you'll see here as well, we've got the vagina here and the bladder here. And so this is on the female anatomy. Now, if we go to the male anatomy here, which maybe I'll just increase in size so that we can see it more fully. Let's see here. Let's go back to this normal size here. There we go. You'll see here that the pelvic floor muscles are right here, and they do cross the anus all the way to the pubic bone, from the tailbone to the pubic bone, crossing the anus on men. What I also want to show you here is a different view. So you can see between the orifices, the anus and the vagina, you have between the anus and the sexual organs, you have the pelvic floor muscles here. So the pelvic floor muscles do include the anus area as well as the genitalia. A pelvic floor contraction, if you look here at the final image in the bottom corner, the bottom right corner, you'll see an image that shows how you squeeze and lift it up and then you relax. So that when you squeeze and lift it up, there's a contraction and the energy is pulled inwards, and when you relax, the energy drops and it goes outwards in the relaxation. So while you're looking at these images here, I'm going to talk a little bit about how we do these Kegels, how we do these floor muscles. We use these floor muscles. So first off, to learn to feel these pelvic floor muscles or the Kegels for the first time, many try to sit on a toilet and begin to urinate. And before you are ready, you try to stop the urine. Before you actually do urinate, you stop the urine, or before you try to urinate, you stop the urine from flowing. When you do this, you actually you are using these muscles, the pelvic floor muscles. Many people squeeze the muscles around the anus and miss the area referred to, which is the actual smaller muscles that help you from urinating if you're trying to hold your urine back, or it helps you to stop the urine if you're ever urinating. It takes practice. So right now, I just want you to think about this here as you're seeing these images here that can help guide you in doing the Kegel squeezes. I want you to here just imagine that you are about to urinate, but you want to hold it back. So imagine you're about to urinate, but you want to hold the urine back. So that little contraction that you've done is the Kegel muscles. So you can do a very small in that way, while many people actually do a stronger contraction, and where they include their bum muscles, the buttocks, and sometimes even the stomach muscles to squeeze and create that contraction. So it can be very mild, very gentle, very subtle, or it can be actually quite strong. Many of the medical websites about pelvic floor muscles and Kegeling, or using the Kegel muscles for medical purposes to help with the bladder and to help with any urinating problems, will suggest not to use the big muscles of the buttocks and the abdomen, but staying with the small contractions of the actual perineum, or the muscles that are closest to the orifice, the opening out to the body. So I want you to try this idea now. I want you to try you doing the Kegels. So you can see from this image here, this is from Trish McAllister from the Globe and Mail. I'm just going to bring your attention actually to, first of all, the posture here. So there's an incorrect posture, and then there's a correct posture that's suggested here. So no slouching, no leaning your weight back with your tailbone tucked under your body. You can see this image here, the way that sacrum, the tailbone is tucked underneath. Sort of like when you have your lower back is tucked under. That's not what's being suggested here. The correct is sitting straight up with weight forward on your perineum area and tailbone. The perineum is the muscle area between the genitals and the anus. So some people in yoga and Pilates, they talk about the sits bones being pointed downwards. So you can see here, when you sit down, there's bones that touch that touch the surface of where we're sitting. Those we call, and sometimes sits bones, where you sit, and they want them down, not elsewhere, but pointing down. And when you do this, your tailbone points down and your spine is more erect. Even you can even just touch your hair at the top of your crown, right up here, and you just take a strand of hair and you just pull that strand upwards, and it can help pull your body straight upwards, and so you have a better spine there. Now, again, we have an image here of where the pelvic floor muscles are, and here they suggest you can use this imagery of a jellyfish Kegel exercise, envisioning moving your pelvic muscles like a jellyfish, contracting and expanding as it swims up. So they're showing you an image here to help you understand the rhythm of the muscles that can look like a jellyfish, the contraction and the relaxation, and the contraction and the relaxation. So while you've got this fresh in your mind, I invite you to go ahead and sit straight upright. And of course, if anything does not feel comfortable for you, then do not do any of what I'm suggesting. It's just, you can watch, but stop doing any exercises that do not feel comfortable for you. You know your own body, and you're responsible for your own health. And there is a disclaimer at the end of this video that there, by no way or means are we advocating here at Reclaim Fend Fire or the video. This is not medical information. It is not advice and should not be treated as such. With the medical information on this YouTube channel or website is provided without any representations or warranties express or implied, without limiting the scope of what I just mentioned. Do not warrant or represent the medical information on this YouTube channel or website. You must not rely on the information on our website as an alternative to medical advice from your doctor or other professional healthcare provider. If you have any specific questions about any medical matter, you should consult your doctor or professional healthcare provider. If you think you may be suffering from any medical condition, you should seek immediate medical attention. You should never delay seeking medical advice, disregard medical advice, or discontinue medical treatment because of information on our website or YouTube channel. Okay, so now that we're ready to try this out, go ahead, make sure you're sitting properly in the chair, and start by squeezing the muscles between your genitalia and your anus. Now you can look at the anatomy that we have here on the screen to help you understand what you're trying to squeeze. But I also want to bring you back to the idea of imagining that you are about to pee and you want to hold that back. So imagine you're relaxing those muscles to pee, but you hold it back. Whatever you just contracted, that is the beginnings of what we're talking about. That's the Kegel muscle there. So I'm going to invite you to, if you pretend you're going to pee and you hold it back, hold it for a count of 3 seconds. Then release and relax. So let's try that again. Again, whatever imagery helps you, I'm going to invite you again to imagine that you might be needing to go pee, but you're holding it in, or you're about to go pee and you want to stop it. That little contraction is what we're talking about. So go ahead, imagine you're about to pee and then you stop doing that. Now hold it for 3 seconds. 1, 2, 3. Then release the contraction and just relax. Now you can continue repeating this so that you can get comfortable with this contraction, locating the muscles, contracting it, then releasing the contraction and relaxing. Try to do 3 to 5 sets of counting to 3 seconds, counting up to 3, and then releasing. As you progress in this practice, then you can lengthen the time as the muscle gets stronger. You can practice this many times a day when you feel proficient at finding the exact muscle and you see the results, meaning that you feel you have access to it more readily and you feel like the contractions are getting stronger. And you can choose for your own body how many times a day you would like to do this and for how long the count should be. What's important is that you relax in between sets. Another thing you might think about when doing this, if it helps you, you can try breathing with this, meaning that you would exhale and squeeze the Kegel muscles. Then inhale and relax the entire area. When doing this practice, it's important to allow yourself to relax and let the muscles relax and drop back after the contraction. So fully relax the muscle. This way, not only does the muscle get stronger, but it gets longer too. This information has come from the website. And I'm just going to quote the website here. There's some of the information is from the mayoclinic.org website, and some is from webmd.com. That's www.webmd.com. So I hope this helps you in understanding what Kegels are and where to find them. And when we do this practice, some of the breath sequencing, breath circuits that I do that I call the Reclaiming Feminine Fire practices are using this Kegel, the Kegeling as part of the practice. So oftentimes it might be that we will exhale, hold the breath, and then when we're with that breath held, we locate the muscle and we squeeze it. We locate the muscle and we squeeze and relax it. We squeeze, relax, squeeze, relax with a held breath. And then we relax the muscle and then we relax our bellies and then we take a half breath in. So you may have seen that in some of the Reclaiming Feminine Fire breath sequences that we do on this Reclaiming Feminine Fire channel. So hopefully that will help you understand what the Kegels are and how to use them so that when you come and join us in our Reclaiming Feminine Fire practice, Reclaiming Feminine Fire exercises, you'll know what we're doing, which muscles we're using, and how we're using them. I hope this helps you and look forward to seeing you again on our YouTube channel here at Reclaiming Feminine Fire. Take care.